Hi, I'm Dr. James Hall, an orthopedic surgeon at the center. You, your coach, and your care team at the center have spent a lot of time getting you ready for surgery. The time is nearly here. This week, focus on getting lots of rest, staying hydrated, and avoiding anything that may raise your risk of infection. Wear clean clothing and sleep in clean linens. Avoid having close contact with pets, including having them sleep with you. The most common infections after surgery involve bacteria commonly found on the skin and in the nose. The week before surgery, it is important to reduce your risk of infection by using a special cleanser and antibiotic ointment. To help prevent infection, all patients undergo bacterial decolonization before surgery. You will need to purchase an antiseptic liquid soap called HibaCleanse and use it when showering for the first 5 days before surgery. Your surgeon will order a prescription for intranasal mupirocin ointment for you as well. Use the mupirocin twice a day for 5 days prior to surgery. You can use the table in your total joint guide to track your decolonization. The night before surgery, a nurse will call you with your arrival time to Cascade Surgery Center or St. Charles. Follow the instructions they give you on medications to take or avoid, and do not eat or drink anything after midnight. The things that you should bring to surgery include your total joint guide, comfortable clothes, glasses or contacts, hearing aids, denture containers, photo ID, insurance card, and your walker. On the day of surgery, you will check in and a pre-surgical nurse will call you back in the pre-surgery area. You will change into a gown and get an IV started. The surgical site will be prepped, which means your hair will be clipped and side marked. You will need to meet with your anesthesiologist and take pre-surgical medications. You wipe down your body with chlorhexidine wipes to decrease the risk of infection. The surgery itself takes 1.5 to 2 hours. Your coach can wait in the waiting room. After surgery, you will wake up in the recovery room. A nurse will check your vitals and allow you sips of fluids as you awaken. Once you're ready, your nurse will call your physical therapist to get you up and walking. If you have stairs at home, the therapist will help you go up and down the stairs prior to discharge. Before you can be discharged, you must be able to complete the following: walk safely with a physical therapist, safely navigate up and down stairs, eat and drink without difficulty, urinate, and be comfortable on pain medications. Whether you are in the hospital or Cascade Surgery Center, the goal is to get you progressing to go home as soon as you're ready. Performing activities of daily living in your home is the best form of therapy and recovery. Thank you for watching. It is important to watch all of these videos to prepare for your upcoming surgery. If you have any questions, please give us a call at 541-382-3344.